Week 2 of my hamstring tear, and this is the week where a secondary injury becomes a real risk. So the acute pain in my hamstring had settled and I was mobile, but I was walking with a significant compensatory pattern, and as a chiropractor I know exactly where that leads. So altered gait puts abnormal load through your lumbar spine, your low back, the hips and the knees. So you protect one structure and then inadvertently stress another. And this is how a hamstring injury becomes a hamstring injury plus a back problem. So week 2 has two priorities. First, continue protecting the tear, and then secondly, restore normal movement patterns as early as possible, even if it's a little bit uncomfortable, even if it feels counterintuitive. So uncomfortable is all right, but pain is bad. So it's a bit of a fine line working out which one you're at. So in terms of rehabilitation exercises at this point, I was doing prone straight leg raises and then isometric loading in a supine position with my knees bent. So what I did, press the foot into the floor. So very gentle end of range stretching. Well, end of whatever range I could make, not end of my normal pre-injury range. So not to the point of any horrible pulling sensation, but just so you could feel something happening in the muscle. Week 2 is also the week where post-exercise soreness can be alarming, or shall I say post-rehab exercise soreness, because what can happen is you do your rehab exercises and then you flare a little bit, and that is completely normal, promise you. So patients sometimes do contact me or the clinic after their first session of strengthening work, convinced that they've re-injured themselves, but actually in almost every case they haven't. Delayed onset muscle soreness following early stage rehab is normal and expected and part of the healing process. So the body is laying down new tissue, completely normal. Some ache the following day is not a setback. It's a signal to you that adaptation is occurring, and that's what we want. So if you're managing a hamstring injury and unsure how to structure your rehabilitation, this is exactly the thing we work at Right Track Chiropractic. And I will update you on my dicky hamstring some more next week.